Good afternoon, everyone. Thank you for joining us on this absolutely beautiful Wednesday here in Erie County to discuss the pandemic and give you some updates. We all know that there's been a number of different programs that have been put forward by both the federal and state government to help assist those who've really suffered through this pandemic financially. Most recently, we announced the Emergency Rental Assistance Program. This program will open next Monday, March 29th, but you can find some information about this program at eriecountypa.gov. And next Wednesday, we're going to have a guest on with us who will give those listening and those viewing many more details about the program. So stay tuned, tune in next week to learn more about the Emergency Rental Assistance Program. Today in Erie County, we have 27 cases of COVID-19 to report. Unfortunately, we have one more death to report also. This brings us to a total cumulative positive case number of 18,401 and total deaths at 449 in the NEDS database. The positivity rate for Erie County was 5.7% from March 12th through 18th, according to the Pennsylvania Department of Health. The State Department of Health has also moved us from the substantial category to the moderate category in terms of cases within the county. As of this morning, there were 16 total COVID-19 hospitalizations within the Erie County hospitals, with one person being on a ventilator in those hospitals. While our daily case numbers appear to be a bit lower, we have every reason to believe that we must continue to remain cautious and to remain diligent. Just earlier today, I had conversations with my counterpart in Erie County, New York, which is the Buffalo region, and they are seeing an increase in cases and hospitalizations in that area. The same is true for Chautauqua County and other surrounding counties in New York State. And of course, we border on Chautauqua County, and there's often much traffic between us and New York State, Western New York particularly, along I-90. So if counties so close to us are experiencing increases, we know that this could very easily and most likely happen here in Erie County, Pennsylvania, even with the vaccine available and becoming more widely available. So again, I encourage you to get vaccinated when it is your turn. Take that opportunity. Remain diligent regarding all the mitigation efforts to date, and to remain continually cautious, knowing that this virus is still with us and is always looking for its next host. To speak more about the virus, the variants, the vaccine, we now would like to welcome Dr. Howard Nadworny, infectious disease physician consulting with the Erie County Department of Health, to share some information and updates with us. Dr. Nadworny.
Good afternoon. We have been notified in Erie County of several cases that have been determined to be caused by what is known as the B.1.17 variant, which was first identified in the United Kingdom and has been spreading all over Europe and the United States. The reason that this variant is of concern is that where it has shown up, it has been much more contagious and has caused more severe infection. In fact, this is the variant that is leading much of Europe to be shutting down again this spring. It has been found in larger numbers in Florida and in many parts of the country. And although we are not doing extensive testing for this, it keeps turning up in many different places. The reason that the variants of concern are of concern is because they have mutations that make them, one, more contagious, two, more capable of causing severe disease and death, and many of them are less susceptible to the vaccine that we're using. The vaccine that we are using was developed with the original strain And many of these mutations not only make the virus able to spread much more easily, but make it much less susceptible to those who have been immunized, and particularly less susceptible to those people who've had COVID in the past. We are learning that the immunity that people get from COVID infection is actually much less than the immunity you get from vaccination. And in many cases, people who have had COVID are not immune to the newest strains. The B117 strain appears to actually be quite susceptible to vaccination, but the strains from South Africa, Brazil, New York City, and now strains being found in upstate New York are much less susceptible. And because they are being found in multiple places, it's very likely that if they are not yet in the Erie area, that they are likely to come here. Because our numbers are going down, we should be very proud of the work that's been done, whether it's vaccination or mask wearing or avoiding large crowds, particularly unmasked and indoors. But this is not the time to abandon those or slow down our measures, because that is exactly what will help the virus spread. And as the B117 variant and others become more common, it is very likely that if we do relax our vigilance and there are more grouped events and fewer people wearing masks, that we will see an increase in spread in Erie, as well as an increase in hospitalizations. And we all would really like to avoid that. Vaccination does appear to be much more effective at preventing infection, even with the more resistant strains, than past infection. So that's why people who have been infected in the past are still being recommended to be vaccinated. So I would encourage everyone to get vaccinated whenever possible, whenever the opportunity comes about. It does appear that the Johnson & Johnson vaccine, the Moderna vaccine, and the Pfizer vaccines are probably likely to be very comparable in their ability to protect us against infection from all the different strains. So I do not have a concern if someone was offered one vaccine versus the other to recommend that they get it. Thank you.
Thank you, Dr. Nadworny. As always, great information. With us also today is Melissa Lyon, the director of the Erie County Department of Health. Melissa's not going to have specific comments, but she will be available to the media, as will Dr. Nadworny, for your questions. And so today we're going to start with Joel at Talk Erie.
Thank you, County Executive. Good afternoon. And I guess my first question is for Dr. Nadworny. And let's stay with the variants here, Doc. Talking about the number of positive COVID cases out of Erie County that contain the variant, do we have a specific number yet?
I'm aware of 2 confirmed variant cases, but the problem is that so few cases are being tested. We send some samples to the state, but all the tests are done at CDC. Mostly they're being done randomly and in very small numbers. So the fact that we have found 2 cases doesn't mean we found 2 out of 1,000. We may well have found 2 out of 10. I'm not sure how many have actually been tested from Erie County, but I suspect the number is very, very low. So in a sense, we're quite blind as to how much of the variants are here. All we know is that if they have found 2 cases, it's likely that there are a fair amount of variant cases already spreading in Erie.
And maybe a quick follow-up to Melissa Lyon. Melissa, are you finding out faster, the turnaround from a positive test to a known variant from the CDC? Remember last week it was a full month before we found out.
Thanks, Joel. The time frame for turnaround has not necessarily improved, and I'm not sure that we should expect it to improve just based on the methodology that's used to test the variants. I was asking on a call earlier today the length of time that may take, because it's actually a sequencing process, and that sequencing is not necessarily fast. So if you can imagine the number of samples that the CDC may be receiving and then having to process, I'm not sure that it's going to get better with the CDC's turnaround time. However, we also got confirmation that the state is still looking to be able to do the sequencing at a state level. And so hopeful that if and when that is up and running, we would get faster turnaround times. Though I don't know any details around, would it be random sampling? Would it be select sampling? I don't know what that would look like. So we're still a ways out with answers on that. Thank you.
Thank you.
Thank you, Joel. We'll now go to Erie News Now.
Hi, a question for, let's go with Dr. Nadworny here. Doctor, how concerned are you about these variants, knowing that they're here in Erie County, knowing that surrounding counties, A, have them, and B, are seeing surges in cases or spikes anyway? Do you expect that we will see that here? Is it a reasonable assumption that it's headed our way?
I'm worried about a surge because I'm worried that people will, with the warmer weather and people starting getting vaccinated and being tired of COVID, that more people will stop wearing their masks and start having dinner with each other and start having social gatherings with each other. And those more contagious strains will spread much faster. So yes, I'm worried. We clearly have had the ability in Erie County to slow it down when people have really put in the effort of being careful. So I'm hoping that people don't relax their vigilance, at least for the next 4 to 6 weeks, until we have a better sense of where we're going. In terms of the variants, the B117 variant is a concern because it's much more contagious, but the vaccine appears to be very good for it. The other strains, particularly the ones that contain a mutation called E484K, which is a specific amino acid change, that's the one that's been found in New York City, South Africa, and Brazil, make the virus much more contagious, but it also makes the virus much less susceptible to the vaccines. Those strains are the ones that I'm most concerned about, but I don't know where the testing is for those variants. And I suspect that that strain is coming to the US slower and later than the B117 strain, but that's the group of strains that concerns me most. Some of those have been found in Rochester, which is doing testing with Walter Reed. Their lag time was also about 4 weeks, but the fact that it's been found in upstate New York suggests that we probably will be seeing that as well. We may not know it, but I suspect we'll be seeing it. So yes, I'm concerned about increasing cases and increasing illness. We don't have the right looking glass to know whether it will happen for sure, but we do know that the measures that we've taken to prevent the spread of the wild type of COVID work very well for the variants. You just have to be very diligent for them to work.
Thanks.
Thank you. We'll now go to Jet TV.
Hi, Scott Bremner filling in today. Thanks for taking some time with us. Our question, and I'm not sure who best would want to answer this, but it's about the availability of doses, in that we kind of get two stories. In one, it's like, well, we're going to ramp up production and there's going to be a lot of doses available. But then again, there are also situations, different states that are lowering the age group, allowing more people in. Can you get a sense for how things are going between the increased demand and, if there is an increased supply, what it's going to be like? Are you confident that we will have the doses we need moving forward as more people become eligible?
Well, I don't think we'll move to the next eligibility level until the people in 1A are vaccinated, and that's something the state has set forward, and they are sticking with that. But I'm going to ask Ms. Lyon to talk a little bit more about vaccine availability in the state.
Yeah, so I appreciate the question. And as of now, the actual availability of vaccine is becoming more consistent for those that are selected as providers. So the state had selected roughly 300 providers, give or take, that would be considered high throughput vaccine delivering systems. And the Erie County Department of Health was one of those, as well as AHN, UPMC, Hammett. And the idea is this week's doses will be consistent for the next 4 weeks. So which each system received this week will remain consistent. So one of the things that does is it allows us to plan a bit better as far as how many doses we'll be getting regularly for the next 4 weeks. And then moving forward, I suspect that will change again. Prior to this, what would happen is we would all order vaccine, and then the state would determine how much vaccine they could allocate to fill those orders. And that was a very frustrating process. So if we ordered 3,000 vaccines, we'd have to wait and figure out what was provided, which could be 1,000 or 500. So the nice thing about this is we know consistently for the next 4 weeks what we'll be getting. To answer your question about increased doses in production, I do think that the story does change from time to time, and it's not necessarily a story, it's real life events that are happening. So production being projected at one level and then actually being able to deliver on that production can be difficult. I don't know the specifics behind each of the manufacturers, and I'm not here to speak to those because I'm not the expert on that. But I can assume that no matter what type of manufacturing you're doing, you're bound to run into barriers along the way. So with that being said, I think we still have to remain very patient about the vaccine that we are getting. I can assure you that all of the communication that we're having within the health systems is vaccines coming, we have appointments scheduled, and we're getting it out as fast and as quickly as we can. And there is no vaccine that is sitting on shelves more than 7 days, maybe out to 8, but I can assure you it's really not sitting around. Not exactly the answer you were looking for, but the best information I can provide you at this time.
Thank you, Scott. Erie Times News, David?
Yes, Kathy, it's David. I want to get back to the rising counts in some of the counties around us, including Buffalo. I know Allegheny County reported a high count today. Whether this is for Dr. Nadworny or for Melissa, is there some inevitability that the counts will go up here, or is there still a chance that we may continue to see low numbers?
Dr. Nadworny, would you like to take that?
I'll be happy to take that. David, I don't think that it's inevitable because the spread of the virus still depends on human behavior. So if humans wear masks and they avoid indoor unmasked crowds and they don't do lots of large group dining inside restaurants, then we probably will see many fewer cases than if people do that. So no, it's not inevitable, but I think we are all concerned about it because the attitude of most people is that they're tired of this and they want to get back to more normal things.
And then on the other hand,
so that's the reason for
the lowest. We're also seeing a very low hospitalization number countywide. Is there a bit more confidence that we won't see an increase in hospitalizations because of the number of older people who have been vaccinated?
I am hoping that that's true because that's really the primary purpose of this first round of vaccination. But only time will tell. In most places that are seeing increasing cases, they're also seeing increase in hospitalizations. And so it may be that those strains that are infecting people are either less susceptible to the vaccine, or it may be that they're infecting the people who haven't been vaccinated. Because remember, we still have a lot of people, even in the highly susceptible age groups, who have not yet been vaccinated. So it's probably a combination of factors, but from my point of view, if the hospitalization rates do not go up by very much, I will consider that a victory, even if we see an increase in cases.
Thank you.
Thank you.
Just anecdotally, well, it's not anecdotal, I guess it's really happening in Erie County, New York, from the county executive over there told me that in 2 days, their hospitalizations increased 20%, and that 50% of their cases were people 64 and younger. So again, I don't think that we can just say because most of the elderly have been vaccinated that we're not going to see hospitalizations or that we're out of the woods. Don't forget, you know, it was county government who had a 24-year-old, unfortunately, hospitalized and then pass away. and that happens all over this country. So it's not just related to age. We'll go back to Joel at Talk Erie.
Yes, I think this might be a good question for Dr. Nadworny again. Dr. Nadworny, there continues to be concern reported nationally about the cautious message being sent to fully vaccinated people, concentrating on all the limits instead of the ability to regain a more normal life like hugging your grandchildren. Can you respond to that?
I think, Joel, although we all want life to get back to normal, I think the concern is that because we don't yet totally understand the dynamics of this pandemic and the new variants that are showing up, I think the CDC wants to err on the side of being cautious. I think if they were to say, okay, you've been vaccinated, you have a 95% likelihood of being protected, you can do anything you want, and then it turns out that there is an increasing amount of spread in that group, or the protection is much less than 95%, they're going to have to then change their rules back. And I think that most governmental agencies would rather not do that, especially because what we see everywhere else in the world is that cases are going up. So I think they're just trying to be very cautious. I think that people who are vaccinated can safely assemble with small other groups of people who've also been vaccinated. But I think overall, it's really important that people be careful until we have a large enough percentage of the population vaccinated. That's going to make much more of a difference than just a small number of people. But I think they're just trying to be cautious because every time we've relaxed our guidelines, we've seen increases in cases.
Are you worried that the overall negative messaging, though, will hold down vaccine demand? It really is kind of a dance here of setting the right tone.
No, actually, I think that as we continue to see cases and people are dying and we see increasing cases everywhere else, I think more and more people are wanting to get vaccinated because I think people do understand that vaccination is the path to having more freedom and more flexibility. And if they recognize that it won't happen immediately, I think most people are wise enough to understand that even if they're delaying their gratification, the gratification is likely to come. I think it's the wrong message to say, well, if you can't be immediately able to go have a big party after you get vaccinated, so why get vaccinated? I'm not sure that message really resonates with most people. I think most Americans understand that this is a longer haul and vaccination is a key part of the process, but it's not the only way to keep infections down.
Thanks.
Thank you. We'll go back to Ethan at Erie News Now.
Hi. A question for Director Lyon. We're looking at later this week a day with 3 clinics going on. Are we getting closer and closer to that sort of being normal, so to speak, where we'll have days where there are perhaps several mass vaccination events going on, kind of cranking out vaccinations?
Yeah, thank you, Ethan, for the question. I do believe that you're going to see more consistent, larger vaccination clinics. And when I say larger, we're using the cutoff as 1,000 or more throughput being what we call a large clinic. That is a fairly heavy lift. As long as we can keep the manpower in good spirits and healthy and able to deliver the services, I think you're going to see more of that for sure. I also believe the healthcare systems, per some communication that's happened internally, are increasing some of their capacity on site as well. So again, it kind of goes back to the number of vaccines that we're getting routinely will be pushing us to get that out quickly and hold these consistently. We are also still going to do targeted, so populations that are have barriers to getting to a large clinic, maybe have some special requests. We have an ongoing list of what that looks like. And so it's a combination of large and small clinics. The other piece that I thought I'd take a minute, and Ethan, I hope that answers your question. I do want to circle back to something I'd add to David Bruce's question about Erie County and Allegheny County. New York, and I'd be remiss if I don't talk about the public health infrastructure. So from a national strategy, we will be relying heavily on the public health infrastructure of New York to help us contain disease nationally. So their public health infrastructure will be responsible for disease investigation and contact tracing, and hopefully human behavior compliance. And so this is a really important piece to talk about, is that our national public health infrastructure is what we depend on to prevent the spread of infectious and communicable diseases throughout the entire country. And this is a prime example that while Erie can take care of Erie, we need our surrounding neighbors to also be taking care of their residents and their communities. So that's the piece I'd like to add on a more global perspective. So thank you. And Ethan, if I didn't answer your question, feel free to pitch me a follow-up. Thanks.
Oh, that was spot on. Thank you.
Thank you, Ethan. And I'm just going to say we have the Medical Reserve Corps, which continues to assist in some of these clinics. And as these clinics increase and the clinics happen in more places, we're going to need more people in the Medical Reserve Corps. And we're going to come forward with more information in the future about this. But I'm just going to put out a teaser, a plea, I guess, right now for people to look into that. If you're a person particularly who has any kind of medical background, but you don't even specifically need a medical background, but the Medical Reserve Corps is going to be a key component going forward. And if you'd like more information, you can just Google that on our webpage, and you can find out more about the Medical Reserve Corps. And now we're going to go to Jet TV to Scott Bremner.
Thanks. Just one quick additional question for Dr. Nadworny. I was taken when the doctor said that in most cases when we've seen some kind of relaxation or some kind of backing off of the restrictions, that has led to, if not a surge, at least a bump in the numbers. We have one coming up here for Easter Sunday from the state. Is it your expectation, doctor, that we will see some kind of increase in numbers in Erie County based on the fact that those changes are coming into place?
Well, Scott, I'm hopeful that if people continue their diligence, we won't see a bump. It's totally dependent on what people are doing. And even with Easter Sunday, if they go to church and they're wearing masks and they're not singing, which is one way to spread the virus very effectively, then they could very well have a very safe event. So it really depends on people still being very careful. Masks are really a critical part of this, as well as, of course, the size of gatherings. So yes, we could see an increase, but I have noticed that in Erie, when people have really paid attention and been diligent, we have had fewer bumps, particularly over last summer and early fall, than other places did. So clearly people in Erie County have been very good at reducing the spread when they have tried. So what I'm hoping is that if we don't relax our vigilance, then Easter and Palm Sunday will be safer events, and we won't see this kind of surge that has followed other major events.
Thank you.
Thanks.
And we'll go back to the Erie Times News to David.
Thank you, Kathy. Want to talk a little bit about whether the state has had much contact with the county about how they're going to go into phase 1B. Has there been any kind of timeline at this point? I know it's a statewide decision, but has there been any communication about that in recent days? Maybe that's a question best for Melissa.
Yeah, I can turn that over to Melissa. We've had some conversations more around what happens in 1B and how we will assist with 1B, but I'm going to have Melissa speak to that and some of the conversations that she and her team have had.
Thank you, County Executive and David, for the question. There have been discussions around the 1B. I think the state is really trying to get a feel across the entire Commonwealth of capacity and how this would best roll out. That's not impacting 1A opportunities. So here in Erie, we know we still have a number of individuals in the 1A category that still need to get access to vaccine, while they should be scheduled by the end of this month to get an appointment that probably would spill over into April. We know that they won't be getting vaccine until, maybe middle of April or maybe even later, depending on vaccine availability. So with all the planning assumptions, it's been difficult. So I'd say the state's trying to figure out the best way to do 1B in conjunction with those that are still doing 1A. The role that the county health department will have, or our local emergency management, those are still discussions that are underway. So I guess the best answer I can say is stay tuned when we have some solid information to share. And I hope to be able to do that soon. We will do that. Thank you.
Thank you, David.
Sure, and just to follow up on that quickly, Melissa, do you see drive-through clinics or anything like that when we go to phase 1B, or is the way that the large clinics are being set up now, is that working pretty well for Erie?
As of now, we've not discussed the concept of drive-through. We've been doing site visits for large clinics similar to the Bayfront Convention Center that is inside. And some of that, if you can recall, there's a 15-minute wait time as well for the individual post-vaccination that they have to make sure that there's no adverse reaction. So logistically, we're sort of sticking with the inside model. That doesn't mean we're not interested in exploring all options, but right now, likely not drive through in our planning assumptions. Thank you.
And I think the one thing we can't forget in Erie is that weather is often a factor, especially as we are in our spring showers time. So we have a good plan that seems to be working, and I appreciate all the work being done by the team. Joel at Talk Erie, do you have a final question?
I do, and this might be best handled by you, Mrs. Dahlkemper, or by Melissa. Can you give us an update on how things are going with the schools in Erie County?
So we continue to be extremely supportive through our strike teams with our school districts. Again, I can't say enough about the superintendents, the administration, the teachers of our schools, and all that they have had to go through this year. It's been a lot, and I want to give a shout out to all the parents, because many parents have had many struggles, as we know, trying to work and help their children learn and all of that. So I'm going to let Melissa speak to anything specific about the schools, but I did want to give a shout out to everyone who's worked so diligently to keep not only our students, but all the staff at schools safe this year. Melissa?
Sure. Thank you, County Executive. And I appreciate you giving that shout out, because I would have done something very similar. They've done a fantastic job, especially around their pandemic coordinators and the work they've been doing. It's been a hard year for them as well. And going into our second year, I understand the difficulties. As far as school districts, we do have communications regularly through our liaison for schools and with the IU5 in particular. There have been schools that have experienced increased cases, and they've followed the guidance whether they're going to do a virtual or hybrid model. But I'll be honest, over the past school year, there's only been, one or two school districts that, not the same ones over and over, but, weekly that we're getting updates on. So meaning we're not sitting in a meeting talking about 6 to 10 schools having to do a lot of adjustments. We talk about 1 or 2 that are having to do some adjustments. So everyone's doing a great job. I don't think I have anything additional to add. Thank you.
Just a quick follow-up then. Are we looking at, as far as you know, any kind of full in-person at all schools before the end of the school year?
I know that there's a gigantic desire to get back into, everyone in the classroom, full in-person learning. We are still waiting for additional guidance out of Pennsylvania Department of Education around what that could look like. In particular, I think 3 feet versus 6 feet spacing is one of the real pieces that they're grappling with, because it's not just, you can do 3 feet. There's a lot of additional support measures that have to be in place. And then keep in mind, if it does have let's say a classroom that has spacing at 3 foot, we're still using the 6 foot contact tracing definition. So you would have twice as many people potentially out in quarantine. So there's a lot of logistics on what school districts are going to be doing moving forward. So hard for me to predict is I guess what I'm saying, if there'll be full in-person learning. It's just going to have to be a case by case with the school districts as they take a real hard look and analyze their capabilities. Thank you.
Thank you very much.
And we'll go to Erie News now. Ethan, do you have a final question?
I do. A question for you, County Executive, just while we have you on the line here. Thoughts on the incident in Boulder and anything that can be done or you think should be done at the county level to try to prevent something like that from happening here?
Well, obviously, my heart goes out to those who have lost their lives, to the families, friends, neighbors, all those who have been affected by that, and the community as a whole. And realize it's not the only mass shooting we had in the past week. In fact, I think there's been 7 or 8. This is a plague in our country, and it can happen in any community on any given day. And I think all of us are aware of that, but I guess maybe until it hits your community, it's hard to realize the impact that that has on that community. So as a county, we all need to, unfortunately, do what we can to prepare for something like this happening, trying to keep everyone safe, drills, things like that. In my opinion, there needs to be more safeguards done on a national level, even on a state level, in terms of background checks for gun sales and things like that need to happen. So some more sensible gun laws. I know not everyone wants to hear that, but most people I know who own a gun, hunt, use their gun for sport, know that this tragedy can't continue on over and over again. So again, my heart and prayers go out to the community of Boulder, Colorado. Thank you.
Thanks so much.
Jet TV, Scott, do you have a final question? Maybe Scott's no longer with us, maybe, I'm not sure. We'll finish up then with David Bruce from Erie Times News.
Sure, Kathy, thank you. Probably this question's for Dr. Nadler. You just want to go back to Easter Sunday. So if you're in a household where everyone is fully immune from vaccination and you have perhaps maybe children who are not as nearly high risk for serious complications from COVID, what can you do to celebrate that holiday safely? What can you do that you couldn't do a year ago?
Dr. Nadworny?
Making the assumption that people in the household have all been vaccinated, I think that it is probably much safer to have dinner together as a family. Where you get into issues is when the groups are larger and include more people who haven't been vaccinated. And that actually applies to children too, because children are just as likely to get infected as adults, but they are far less likely to have much in the way of symptoms. It may be either mild or in many cases, they're asymptomatic. But I think that in general, with the new CDC guidelines, if the family has all been vaccinated, having dinner together is a very reasonable consideration. I think that I would be hesitant to have large multifamily gatherings at this point, but I think having a family gathering for Easter dinner would be quite safe.
Thank you.
Thank you. Well, I want to thank, again, Dr. Nadworny and Director Lyon for joining me today, and for all of our media for joining us. I want to end with one of our star businesses. Doc's Holiday Bar and Grill on Schultz Road is doing a great job. They have their capacity and masking signs clearly on their front door. Their staff is fully masked. They're not offering bar seating at this time. Food is served with drinks, and their tables are spaced more than 6 feet apart. They're using paper menus, which can be tossed, and condiments are prepackaged and single use. They have hand sanitizer stationed for their customers, and tables are thoroughly cleaned between each guest. So if you have your favorite restaurant, make sure that you feel comfortable going there. If you don't feel safe going in and comfortable, then use their takeout option. But again, please try to support our local businesses so that they can continue to stay viable and be here when this pandemic is all over. Thank you to all of our businesses who've continued to work with us to keep our community safe. As we go through this next week and into the following weeks, get vaccinated if you have the opportunity to. Please remember to stay safe out there by wearing your mask over your nose and your mouth when you exit your house and are around anyone that does not live with you in your home. And please remember to wash your hands frequently. If you feel ill at all, please stay home, monitor your symptoms, get tested for COVID-19. Don't assume you have seasonal allergies. Assume that you have COVID first and rule that out. And if we all do all of these things, I know over the next weeks ahead, we can continue to keep our numbers low in Erie County and we can continue to stay safe. So I ask all of you to help us continue to mitigate the spread of this virus. And until next week, stay calm. Thank you.